pledge will be led by the gentlewoman from Texas, Ms. Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the real. The ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time, then, for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Eddie Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Eddie Bernice Johnson.
Hello and welcome to the Capitol Report. My guest today is Lisa Codispoti. She is a senior counsel with the National Women's Law Center, and she joins me to discuss health care reform and the positive impact it would have on women. The National Women's Law Center was established in 1972, and it works to improve the lives of women, girls, and families through legal and public policy initiatives. Ms. Codispoti is a senior counsel with the Health and Reproductive Rights team, and prior to joining the center, she worked for the Service Employees International Union for nearly 10 years. She is a graduate of SUNY Cortland and holds a Master's of Public Administration from SUNY Albany and a law degree from Albany Law School. So let me welcome you to the show and tell me a little bit about your daily activity.
Oh, thank you, Congresswoman. Thank you so much for the invitation to join you today. The center has been active for the past 18 months or so working on healthcare reform, and that is what I have been spending all of my time on, and making sure that we look at healthcare reform through the prism of how does the current healthcare system fail women, and what do we need to make sure that healthcare reform works for women.
Mm-hmm. How are women faring right now?
Well, women face a number of challenges in our current healthcare system. Affordability is a major issue for women. Regardless of whether or not they have health insurance, women are more likely than men to face challenges related to cost. They're more likely to put off seeing a doctor because of cost. They're more likely to put off getting a prescription filled. They're more likely to avoid going to see a specialist just because of cost-related issues. And again, that's regardless of whether or not they have insurance, which means that a number of women have health insurance that really isn't working for them. They could be left at great financial risk if they, in fact, get sick and have to use their health insurance.
Do women use insurance more than men?
Well, women on average do use the healthcare system more throughout their lives, both for reproductive health needs, but overall for their health needs in total. There are certain chronic conditions that women are more likely to experience than men, and so they do use the healthcare system more than men. And they're also very often the decision makers, healthcare decision makers for their families, caring for their children, advising their spouses, and a lot of times caring for their older parents. I know I had to help my mother-in-law when she was struggling to figure out the Medicare drug program.
Well, so in a sense, women don't fare nearly as well as men. Do women have coverage as often as men?
Women do have coverage as often as men, but it's because of actually public programs that help fill the gap. Women are more likely to have their health coverage through Medicaid, and in fact 7 out of 10 adult recipients on Medicaid are women, and that's because women have lower incomes than men and are more likely to qualify for public health insurance programs like Medicaid. So Medicaid is a critically important piece for women, and in fact, if Medicaid were not there, then women would fare even worse under our current health care system.
And women usually are the ones that will have custody of children, or?
Exactly. So they are dealing with their own health care needs as well as the health care needs of their families.
What are their options without coverage? Is it just Medicaid, or?
No, and in fact, that is certainly one of the biggest challenges that women face. Most people in this country, including women, do get their health insurance coverage through an employer or through a family member's employer. But for women and others who don't have access to coverage through an employer, they're forced to get coverage directly from insurance companies in what's called the individual health insurance market. And that can be a really difficult place for people to have to shop for insurance. And that's because the insurance companies have great leeway in deciding whether or not to sell individuals a policy. They can reject applicants for a variety of reasons, many of which are unique to women.
Mm-hmm. Well, it's interesting, too, that often women don't have coverage when they're young, but often when they become pregnant, they want to get coverage. Is that possible?
If you're already pregnant and you don't have health insurance, you are in a lot of trouble. If you try to buy coverage through the individual market and you're already pregnant, most insurance companies won't sell you a policy at all. If you do try to get health insurance before you get pregnant, we found in research that we published last year that the overwhelming majority of health insurance plans available on the individual market don't cover maternity at all. And some that do charge a rider, which is a separate policy just for pregnancy coverage, and we found that that coverage is often very expensive and very limited. There was one policy we found that was offered by a national insurance company. They offered it in 26 states, and the premium just for that coverage was $106 a month on top of your basic health insurance premiums. That coverage only reimbursed individuals for $2,000 during the first 2 years of coverage, which is far less than the cost of labor and delivery for even an uncomplicated vaginal delivery.
Mm-hmm. So women really are not faring very well in this country.
They are not very well at all.
Well, I just recently read where a mother gave her son a kidney. And realized that in doing so, she lost coverage from her insurance company. And I hear more and more about these kind of situations occurring. It seems to me that even the insurance companies would recognize that we must have a change. But there's still heavy lobbying against the change by the insurance companies. I suppose that the insurance companies, under the various rules that they have now, do a little good for people, especially as long as they're not sick. But when they are sick, it's so many gaps that are created that you wonder where all the money is going. I know that insurance companies like to insure young, healthy people. As they get older and need more coverage, then soon they're into Medicare, which they prefer you to be. They won't pay until Medicare pays. So tell me, what are you hearing from women? Do they feel good about this current situation?
Well, women are certainly very upset about the current healthcare system and are starting to tell their stories more about the many challenges that they face in our current healthcare system. The story that you just told about the woman who lost her own insurance because she stepped in to help her son. We're hearing stories about women who have had cesarean sections who are rejected from coverage when they've tried to get coverage. We heard from a woman today who is a rape survivor who received medical treatment in the days after her horrific ordeal. And when she went to apply for coverage in the individual market, was told, because she was on HIV drugs prophylactically and was in counseling following her rape, she was told that she would need to provide 2 to 3 years of clean HIV tests and have to be out of counseling and off anti-anxiety medication for a year or two before she could get health insurance. So basically, she was rejected from coverage because she was receiving treatment from the after effect of her rape.